If a prostate removal is on the horizon, these are the things I wish I had known before my convalescence. Now, my particular procedure was a frontal robotic laparoscopic prostatectomy. And this video is going to cover the initial recovery, which is the first 10 days where you are in a compulsory relationship with a catheter. More on this in a second. I'd be remiss if I didn't mention that you want to address the malignancy before it spreads outside the prostate. This is the prostate, and it is flanked by these nerve bundles. These nerve bundles have the primary responsibility of helping you achieve an erection. If the cancer spreads outside, and not only the prostate has to be removed, but the nerve bundles as well, you can do the math. The immediate point to address is your stool. Bring these with you. Stool softener, prune juice, oatmeal. Ask your surgeon before you go in, when is the earliest possible consumption? What you're trying to avoid is a hard stool. In this case, hard versus soft will differentiate, with hard meaning you have to actively participate. Soft, it's coming out on its own, you just got to find a place to drop it off. You don't want to exert too much and do anything that could take a chance to disturb this new connection, because then you're back on the operating table, etc. Now in my case, I knew this, but I had a hard stool, so I basically exercised the minimum amount of propulsion to sort of nudge it on its way out, but it ended up taking me, how long was I on the toilet?
3 hours.
The catheter. I had a Foley catheter, which is a tube that goes up the length of your urethra, is anchored in the bladder, and remains there for 10 days. Two things, discomfort and blockages. The discomfort is almost exclusively at the tip of the urethra, technically known as the meatus. Some guys say this is not that bad, other guys say it's Old Testament. Put me in the second group. I only discovered this lidocaine gel after my catheter came out. Had I known, I would have asked for it beforehand. Blockages are the result of blood clots that form from all the work that was done in this area that may get lodged into the catheter tubing. It's recommended that you sip on water immediately, and often you want to reduce the size of the blood clots so that they can flow through the catheter tubing. Your abdominal area is also going to be pumped with CO2 gas to create space in the area so it's easier to work in. That gas is going to work its way up higher and make it very painful whenever you engage your shoulders. So my advice is don't hold anything that you can't afford to drop. Last is the catheter removal. Some guys say it's not that bad, some guys say it's miserable. Put me in the second group again. If I had to do it over again, I would have taken painkillers beforehand and applied some of this lidocaine gel to the meatus, and that should have helped. In the next video, we're going to talk about the abdominal recovery and getting you back in the gym.